So this is the computer setup for a weight-bearing ankle. So when you select the protocol, this should show up. When you're doing a weight-bearing ankle, you'll obviously want to do it standing with a wall stand, right? So you'll click on this wall stand and you'll want to use fixed technique. And then this is your small focal spot. And you would want to bring it to your wall stand vertical at 40 inches. And then you're going to press that auto detent button, and that'll move your tube and it'll align it to the bucky. And you want to make sure there's nothing in the tube's way when you're detenting, because you don't want to hit anyone or anything. Alright, so then here you could go ahead and also set the ankle technique. 65 at 3.2, that's usually the default setting. You could start off using that technique and then adjust as necessary based on the patient factors. And then you'll come on in here. So for a weight-bearing ankle, you'll want to use the step stool for a patient to step onto it. And as you can see, there's a lot of stuff going on here, right? So you would want to take this handle off. So bring this bucky down. And with the newer machines, the tube will actually track to the bucky, so you don't have to move each thing by itself. So you're gonna take this off. You're gonna set it off to the side, or it won't hit anyone. And for a ankle, you do not want a grid, which is what this is. So you'll actually pull it out and take it away, okay? Because you don't want grid lines forming on your ankle x-ray. And then for an ankle, obviously the ankle's not going to be this high, right? So you're going to bring your wall stand all the way down, as low as it can go. And then just watch the tube at the same time. And then let's say they are doing a right side or a left side actually. So we shoot lateral ankles, medial lateral, okay? So you would want this way. So this is a setup for a weight-bearing ankle. So you would want to put a sheet on this little step stool so the patient's not putting their bare foot onto this dirty stool right here. So then the patient will come in, you're going to have them sit down, and you're going to ask for their name and their birthday, and then ask them which procedure we're doing for them. This is our patient Lucas. Lucas, my name's Susan. I'm an x-ray student. I'll be doing your x-rays today. Can you verify what procedure we're doing for you today?
Yeah, we're doing an x-ray of my left ankle.
Okay, can I have you take off the shoe and sock and then roll up your pants to about mid-thigh?
Sure.
Or mid-calf. And Lucas, can you tell me your last name and your birthday?
Olson, July 3rd, 1984.
Perfection, thank you. That's good enough. That's good. So then for your x-rays today, we'll be doing it standing, okay?
Mm-hmm.
So for this first one, I want you to step up here with both feet, okay?
Okay.
And I'll hold on to it. And now turn around and face that sink for me, okay?
Okay.
Good. And then you're going to scoot that heel all the way back towards the board. Yep. And then bring this leg over towards me a little bit. Good. Just like that. So now you're lined up to that left ankle, right? And then you'll just want to make sure that you get the bottom right here. Kind of seems like. And there's kind of collimate in. And then you want to make sure that they're not leaning off to the side. You want them to be straight. So Lucas, I want you to distribute your weight evenly like this.
Okay.
Good. And then keep your toes pointed straight forward. Good. So this will be your AP view. And once you take it, you're going to do your Mortise view. So for your next one, I want you to keep your heel where it is and then turn your foot towards your other. Yep. Good. Just like that. And then I'll actually have you scoot that way a little bit, just because his other foot is in the way. But as you can tell, he's already at the very edge. So even though you're already detented, for these you could actually just turn this key and then move the tube to where you want it to be, okay? Like that. And then for a Mortise, you'll want to look at these malleoli, right? And so you want it to be at the same level. So as you can see, he's already turned medially too much. So I'm not gonna have you turn your feet that way a little bit, tiny bit. Yep, good. Just like that. And then just make sure your tube is aligned with his foot. And then you're gonna take that x-ray. Sometimes patients' AP view might look like a Mortise. There's really nothing you can do about that. Just turn them in medially just a tiny bit. And then the last view will be a lateral view. So for this one, we shoot medial lateral, right? So Lucas, I want you to kind of turn that way. And you're gonna bring this back leg down onto the floor, okay?
Okay.
Good. And then scoot your foot so your little toe touches the board for me. Good. Your heels don't need to touch, just your toes, okay?
Okay.
And then again, you're already turned the key, so you're just gonna move the tube to where you want it to be, okay? So right here, I'm gonna open it up side to side, move it back. And then always make sure you get the bottom of the light, right? So you'll have to play with it to make sure you see it. And then for this one, you want this to be aligned, right? So you could tell his knee's a little bit too far forward, so I'm gonna have you bring it back a tiny bit. Too much right there. And then put a little bit of pressure onto that left leg for me, and then you're gonna go back and you're gonna shoot it. And that concludes your weight-bearing ankle series.